So my name is Peter Hughes and I'm a senior physiotherapist for Rhondda Cynon Taf County Borough Council. So for me, initially, it was because I was mad for sport. You know, everything I did was sport. I was playing rugby, football, cricket, baseball, you know, every night of the week basically. And I wanted to choose a career that was sport related. But then I think eventually, when it came down to doing my course, it was the other bits I enjoyed. You know, it was being on the wards, it was treating chest, it was treating people who had life-changing injuries and seeing their progression, which actually swayed me, I think. So the sports kind of went out the window, but the initial thinking was I'm going to have this career as a professional physiotherapist for Wales or something like that. But then actually, it was seeing the Joe Blogg's story from A to B, which was the most pleasing thing for me, really.
My name is Rihanna Davis and I am Team Manager for Occupational Health. So in Occupational Health, we're a team of health professionals, and that includes physiotherapists, counsellors, nurses, a doctor, and then admin support to help the team there. In occupational health, what we're aiming to achieve is supporting staff within the council in terms of their well-being, but also their health. What we're looking for is supporting them with the impact of health on work, but then also the impact of work on health. So sometimes we have some jobs within the council where the work that they do may impact their health, so we have a legal responsibility to monitor that. So an example of that would be people who work on the bin lorries. They're really noisy, so that can affect people's hearing. So what we do then is monitor the hearing by having hearing tests.
So for my current job, needed experience in MSK physiotherapy. So MSK stands for musculoskeletal physiotherapy, which is treatment of bones, joints, ligaments, tendons, those types of things. It just needed some good experience, some good grounding and experience across a lot of the other areas of physiotherapy, which I got from my time in the NHS. So in my time in the NHS, I had done rotational physiotherapy, so I'd been on neurological wards, respiratory wards, I'd done some amputee rehab, physiotherapy with children, and the progression then was I was able to use that experience and apply for this job here then. To get onto the course that I did, I needed good grades in my GCSEs. I can't remember the exact grades if I'm honest, but I needed mostly passes to get into my A levels. And I knew from my GCSEs and speaking to my careers advisor that I would need a science, I would need a biology, and another. So eventually I ended up doing psychology, biology, sports science, and I actually did a computing AS level. And the requirements of my university course were an AAB from those areas, and the A had to be in biology.
So as a physiotherapist, obviously they need to do their clinical degree in physiotherapy. Then people can progress in certain specialisms. So they could, for example, that could be if they want to provide acupuncture, so they can do specific training in providing acupuncture, and then they can get supervision or getting some experience in that, and then they become more confident and meet their competencies of delivering that. Or it could be that they specialise in something else. So to take our physios, they came in as they got their basic degrees in physiotherapy, then they've done some training in becoming an occupational health physio, and then they may specialise in different things. So one of our physios is trained in steroid injections, and we put them on training for that, and then they get some supervision and some experience whilst they've got somebody watching over them injecting people, and then they run their own clinics from that.
So we're in the occupational health unit. We're at the top of the stairs where staff will come after entering the building. They'll check in at reception with our wonderful admin staff. At the moment they're having their temperatures taken and they're checked for signs of COVID or signs and symptoms of COVID. After that they head on through here and they take a seat in our waiting area. So this used to be full of chairs, but as it stands, limited capacity, so we only have the 2 chairs waiting at the moment, okay? So they take a seat, and when I'm ready, when it's time for their appointment, okay, we bring them through to the treatment room, okay? And this is my room. So this is where I tend to sit. All of my notes are on the computer. I also have handwritten notes as well. The patient tends to sit in this chair here. We keep our distance, I ask them the questions, and we come up with a treatment plan. I also do a bit of an assessment in this area, which is the treatment bed, which is adjustable. Back comes up, legs go down, and it raises up and down to keep your own backs nice and healthy. Okay. You also have a bit of a limited rehab setting at the moment. We've got some band and some other bits and bobs that we use just for general exercises and things that people can do to try and help themselves. Hand washing station in the corner, which is obviously a very big part. At the moment especially, we're trying to just keep on top of infection control, stop the spread of certain things, not just COVID, use everything from your common cold to your flu to your COVID. Yeah. Reflex hammer, which we use as part of our neurological assessments, okay, testing reflexes and certain things in feet and hands. Okay, and then we have the ultrasound unit or machine that we use to scan people. If they need it, we can scan them and help try and help with their diagnosis essentially. So I think in my current job, you need to be able to hear the patient's story. It's asking people questions about their life, which can sometimes be a bit personal. You do sometimes get some stuff that you're not quite ready to hear. But I think the biggest skill for me is being able to listen to hear. Not just listening for the sake of it. My favourite saying is, you've got 2 ears and 1 mouth for a reason. You should listen twice as much as you speak. I think you also needed some good analytical skills, so being able to piece together the puzzle, because obviously people are giving you lots of different bits of information around their health, around their condition, and you've got to try and figure out why they're getting their problem, why have they got this pain, and what can I do to help them essentially, and then be able to guide them through the journey. So in terms of salary, initially when you qualify as a junior physiotherapist, you're probably looking around sort of £22,000–23,000 starting wage. If you were to work in the NHS as a band 5, after 6 months, provided you pass your mentorship in the first 6 months, your wage goes up by I think around £1,000 or £1,500. And then from then on in, provided you're passing, you're meeting the requirements of your job role, and you're progressing year on year, you progress. Your salary progresses yearly until you reach the top of your banding, and then hopefully by then you'll have had enough experience to start looking at applying for jobs in the next banding. And I think band 6 jobs run from around 31,000 up to around 38,000, and then the same thing, you progress through the bandings, and band 7 jobs then you're looking at anywhere between sort of 38 to 45,000 pounds.
So within occupational health, you could get into it in 2 ways really. There's more the clinical route, so you could be a physio, you could be a nurse, you could be a doctor, and then you become like the manager of the occupational health team that way. I'm not clinical in anything really. I just see it as though I'm managing the service. So I see what the organisation needs and then how we can do that. I've obviously done some training in terms of managing an occupational health unit. So legislation, so the law is really important when you're running an occupational health unit, because you've got things like confidentiality, you've got to make sure we can't release any information unless the person gives us consent to do so. But also there's a lot of employment law that goes in hand with it, such as things like making adjustments for people. If they're poorly, then we can support them back in work. So an example would be if someone's taking some medication that makes them quite drowsy in the morning, we might suggest to the manager, how about starting their shift a little bit later on so that they can come around in the morning and get used to that.
So I think in the physiotherapy profession, you know, there are lots and lots of job opportunities. Like I said, I was initially dead set on doing sports physio. There is that side of things. If you're willing to work long hours over weekends, travel, you're all over the place when you can. I think there's opportunities in respiratory physiotherapy, which is treating people with either acute or long-term chest problems. Neurological physiotherapy, where you might be treating somebody who's had a stroke or somebody who's had some brain injury. There's that side of things too. I specialise in MSK physiotherapy, musculoskeletal physiotherapy. There's lots of job opportunities with that. There's everything from amputee rehab, paediatrics. There's some specialist mental health physios. There's also people working with individuals who are suffering from long-term HIV and AIDS. It's everything. It's anything you could think of that I think physio got an arm in most health conditions. Okay, so the best aspects of my job, I think, like I mentioned earlier, is that patient story. So, I think I mentioned that you'll always come across something that you haven't seen, or you need to read about, or you need to ask questions about. In the same vein, no two patients are the same. You'll never see two people with the same story, and every time you meet somebody, they've got something to tell you and something to learn. So I think that's the most pleasing thing about my job, is that it's not boring, it's not mundane, it's not the same thing day in, day out. There's lots of variety in it, and I like hearing people's stories and being able to guide them through their journey.